Good evening, everyone. I'm Tony Shi, president of United Hospital Fund, and I'm pleased to welcome you to our 2021 Gala. While I very much wish we were gathered in person, I'm thrilled and grateful that you have all joined us for tonight's event. We have an exciting program planned for you this evening. The theme for our event is reflection and recommitment. We'll first spend some time looking back at the past year and a half. It's been an extraordinarily challenging time as the COVID-19 pandemic touched every aspect of our lives, tested our region's healthcare system as never before, and shined a bright spotlight on our incredible and dedicated healthcare workforce. We'll also look forward and recommit ourselves to tackling the challenges that lie ahead, healthcare challenges that existed long before COVID-19, including those that were tragically exacerbated by the pandemic. Tonight, we will also present our 3 signature United Hospital Fund Awards, recognizing exceptional leadership to improve health and healthcare. Each is an inspiring story. To tell you more about what we have planned, let me introduce John Simons, Chair of United Hospital Fund's board and tonight's Gala Chair.
Good evening, all. We do indeed have a great night ahead. The 2021 Healthcare Leadership Award will be given to New York's extraordinary million-plus healthcare workforce in recognition of their courage, compassion, and commitment during the pandemic. Tony and 4 other healthcare leaders will participate in that tribute to those who carried us through such a difficult time in our hospitals and in our communities. An award-winning choir of nurses from our region's very own Northwell Health will also be part of our tribute to the dedicated workforce. We will also honor Karen Washington with the Distinguished Community Service Award in recognition of her exemplary work as a champion of food sustainability for over 30 years and community organizer for food justice. And finally, we are proud to award our special tribute to Kenneth Cole for his role as founder and chairman of the Mental Health Coalition to destigmatize mental health conditions and improve access to mental health resources and support. We will close the evening with a special song by Annalissa Vicencio, an arts and music therapist at the Children's Hospital at Montefiore. This evening's event is an important fundraiser to support United Hospital Fund and our work to build a more effective and equitable healthcare system for every New Yorker. So, at several points during the evening, we'll project on the screen how you can support United Hospital Fund with a personal donation. I'm very pleased to acknowledge those who have already generously supported tonight's gala. Please take a moment to look through tonight's journal, which lists our many very generous supporters. I would like to single out just a few. The underwriter of the 2021 Distinguished Community Service Award is TIAA. Let me also acknowledge John and Marianne Castle. For the past 36 years, they have generously provided the flowers for the tables at our galas. This year, they have generously provided virtual flowers by underwriting tonight's event production, and we are very grateful. The support of each and every one of you and all those represented in the program is greatly appreciated. So, thank you all, and I hope you'll enjoy the special evening we have planned for you. And here's our website address for those of you who would like to make a donation tonight. Your support will help build an effective and equitable healthcare system. Now, back to Tony, who will say just a few words about UHF's important work to improve health and healthcare.
United Hospital Fund has a long and proud history as a force for healthcare improvement. From our beginnings in 1879, we have focused on the needs of New Yorkers facing the greatest barriers to high-quality healthcare and optimal health. Today, our work tackles 3 central challenges. First, quality of care. Although we are fortunate to have some of the best healthcare providers in the world here in Greater New York, we all recognize that we must relentlessly continue our work to improve quality. UHF, with our healthcare partners, spread best practices, train doctors, nurses, and other healthcare professionals to be quality improvement leaders, enhance quality measurement and reporting, and work to better engage and support patients and their families. Second, clinical community partnerships. It's very clear that factors outside of the healthcare system, such as inadequate housing, poor nutrition, unemployment, and poverty, greatly affect an individual's health, but the pandemic has brought this truth home in the most heart-wrenching way, particularly among Black and Latinx communities. There is an urgent demand for innovative clinical community partnerships to address these needs. UHF work is fostering collaborations between the healthcare system, public health, social services, and the community to address the unacceptable inequities that are driving health disparities. And third, insurance coverage and access to care. Medicaid enrollment grew by 1 million New Yorkers during the pandemic. This illustrates the importance of the state's insurance safety net at a critical time. Our research and analysis are helping to strengthen the Medicaid program and to focus attention on the more than 1 million New Yorkers who remain uninsured. In each of our three focus areas, we depend on and collaborate with partners, including so many of you watching tonight, and we deeply appreciate your involvement with us. To learn more about our work, I hope you'll visit our website. Now, it is my honor to present United Hospital Fund's Healthcare Leadership Award to the million-plus healthcare workforce across our region for their extraordinary leadership and service during the pandemic. March 1st, 2020, marks the day that New York healthcare workers confronted the first confirmed case of COVID-19, not yet realizing the enormity of the pandemic and the courage, commitment, and compassion that would be required of each of them from that day forward. By early April, New York State had more confirmed cases than any country outside of the United States, with more than 70,000 cases and at least 2,500 deaths in New York City alone. And by this past August 2021, the state had reported over 2 million cases and more than 55,000 deaths. This has been a crisis of enormous proportion, calling for an unprecedented transformation of the healthcare delivery system and demanding sacrifice, innovation, and resilience to face so much human need and such unspeakable heartache. This evening, we salute more than 1 million healthcare heroes from across Metro New York who tackled the challenge of the pandemic head-on, responding to the unrelenting demands and providing a beacon of hope for all of us. They provided and are still providing the best of medical care, disease surveillance, and prevention. They conducted more than 63 million COVID tests statewide, and they administered well over 11 million vaccine doses in New York City alone. We asked 4 healthcare leaders to share their thoughts with us tonight to help pay tribute to those heroes who carried us through such a difficult time.
Good evening, everyone, and thank you for the opportunity to really, opportunity for me to thank all of our healthcare workers for their commitment and outstanding work during the most difficult and challenging of times. The situation which you faced back in the spring of 2020 was unbelievable. We had a pandemic which we didn't know much about. We had situations of fear, anxiety, rippling through all of our communities. We had situations which we have never confronted before. But through the grit and emotional determination, skill, talent, and intellect of our workforce, we got through it. We got through it with flying colors. But as we have gotten through it, we also carry the scars of what that brought. It's not only being there at the bedside of holding the hand of people that are under duress and even worse, dying. That takes its toll, and I know that. But I want you to know that our caring and loving workforce, nurses and doctors and all the caregivers that we have and all the people that work in the healthcare community. You have done heroic things. And if I were going to ever define what it is to be a hero, I would say 3 words: healthcare workers. So thank you.
Yes, Ken, it's true. Our healthcare workforce truly went above and beyond. Importantly, it quickly became clear that not all communities experienced the pandemic in the same way.
Good evening. The COVID-19 pandemic has now killed more Americans than the 1918 flu pandemic. Tens of thousands of New Yorkers have died. Throughout history, pandemics have caused much suffering and death. But if we look carefully and learn from what we see, pandemics can teach us how to live and act on what is important. And what do I mean by that? We must acknowledge that this pandemic has not hit all communities equally. The COVID-19 pandemic laid bare significant health and economic disparities. This is not surprising. Similar disparities in health outcomes are seen across a wide variety of medical conditions, but it is unacceptable, and taking action to change this is a moral imperative. We need a long-term commitment to address complex issues of racial and economic inequities, and to support the safety net healthcare providers who serve historically disadvantaged communities. We'll need to rethink our systems, our policies, our practices, from the big picture to the everyday interactions between providers and patients. There have been countless poignant moments during this pandemic. The healthcare teams have been truly heroic. COVID-19 gave them an urgent purpose to rally together to save lives, show compassion, and provide support to patients and their families. Despite all that was unknown about this virus and the toll it was taking on them, their families, their colleagues, and communities, we owe it to our healthcare heroes to embrace the challenging work ahead.
Nurses and other frontline caregivers showed such heroism.
Calendar years 2020 and 2021 have certainly been the years of the nurse. No other member of the health profession is with the patient 24 hours a day, 7 days a week. These past few months have been especially grueling for all of those on the front line, and every caregiver deserves our gratitude for their courage, great competence, devotion, and deep, deep caring. But whether on the front line or not, each part of the workforce is essential, and each individual is part of a team that faces life's challenges with a particular focus on expertise. After what we've all experienced, I believe more than ever that there is no better way to spend a life than as a healthcare worker. It provides a unique perspective and learned experience that blends both heart and mind. And the direct caregiver's voice can become a powerful force for healthcare improvement, disease prevention, and equitable care. Let's not forget the needs of the workforce who have experienced so much trauma these many months. They deserve our gratitude, but also our continuing focus and care.
The pandemic pointed to the critical importance of a strong public health system.
More than perhaps any crisis in the past century, the COVID-19 pandemic has demonstrated our country's need for a strong health system. And, let me not mince words, for massive investment in public health. Reinvestment in public health must happen for the good of all. It is the key opportunity we have to redress health inequities, particularly those rooted in systemic racism and white supremacy, and to build widespread societal support. Leaders in public health and healthcare also need to shine a critical light on ourselves, thinking hard about how we allocate and use the resources we already have, how to be more worthy of the trust of those whom we serve, what language we use to communicate with those whom we serve, and how to more seamlessly collaborate with partners who also contribute to the production of health. Over the past year and a half, we have seen that even in a city as large as New York, the best way to unite these approaches and improve the public's health is to meet people on their own terms in their own neighborhoods. I am so proud of the work our health department has done in the neighborhoods hardest hit by COVID across every borough. We teamed up with community health workers, faith leaders, care providers, and trusted nonprofits, and we started by listening to them. Together, we set up COVID testing sites and connected residents to needed resources, including food pantries, mental health services, and health insurance. We've grown this network during our historic COVID vaccination campaign, deploying canvassers for one-on-one conversations to build vaccine confidence, visiting over 1,000 community practices via public health detailing, and investing tens of millions of dollars in community-based organizations. By approaching our work with humility and by living up to our agency's core values of science, equity, and compassion, we can proudly say that many lives were saved, even as our work continues. In the wake of the seismic shifts wrought by COVID, the answers have never been clearer, and our will has never been stronger. The time for a public health revolution is now. I look forward to joining with you on this important mission.
Courage.
Compassion.
Commitment.
That's what New York's workforce is all about. That is what we celebrate tonight.
Thank you, Ken, Lorraine, Eileen, and Dave, for your thoughtful words and your essential leadership. To conclude our tribute to New York's healthcare workforce, we are so pleased to feature a special performance by the Northwell Health Nurse Choir. In case you're not familiar with this talented group, let me fill you in. The choir's journey began in 2020 when 18 nurses from different hospitals, specialties, and locations within the Northwell Health System came together. The power of music lifted their spirits, particularly during the pandemic when nurses and so many others were called on to relieve so much suffering. Well, this incredible group of singing nurses has appeared on this season of America's Got Talent and has captivated the show's judges and the world with their performances.
Yeah! You know why I want to stand for you? So that I can do this.
I think to myself, oh, what a wonderful world.
We are so pleased to welcome them to our evening to perform a song in tribute to the heroic efforts of our healthcare workforce.
Thanks for the introduction, Tony, and welcome to all the attendees at the United Hospital Fund's Gala. We wish we could all be together in person.
On behalf of all 18 members of the Northwell Health Nurse Choir, we are so thrilled to share a special performance we did tonight, particularly as part of UHF's tribute to the entire New York healthcare workforce for our work during the pandemic.
Nurses and all other dedicated healthcare workers across our region rose up to meet extraordinary demands during the pandemic, because that's what we do for our patients and for our community.
We hope you enjoy our performance of Rise Up.
See ya.
And I'll rise up, I'll rise like the day, I'll rise up, I'll rise unafraid, I'll rise up, and I'll do it 1,000 times again.
And I'll rise up, I'll rise like the day, I'll rise up, rise unafraid, I'll rise up, and I'll do it 1,000 times again.
What a wonderful performance and group of multi-talented nurses. Thank you so much, Northwell Nurse Choir. Our next award this evening is the Distinguished Community Service Award. This award recognizes private citizens acting as volunteers who have led specific healthcare projects or initiatives responding to important healthcare needs. We're very pleased that TIAA, the nation's largest provider of financial and retirement services to the nonprofit sector, is the underwriter of this award. This is the 16th year that TIAA has been the underwriter, and we greatly appreciate their generous support. It is now my great pleasure to introduce Tashonda Brown Duckett, the President and CEO of TIAA, to present this year's award.
Thank you, John, and good evening, everyone. Before I introduce this year's honoree, let me first say that we at TIAA are especially pleased to be a part of this evening's event. It's a privilege to support United Hospital Fund in its work in this important award. TIAA and United Hospital Fund have much in common. In particular, we're both dedicated to serving those who make a difference in the world through their work. I am so pleased to present the 2021 Distinguished Community Service Award to Karen Washington in recognition of her exemplary work as a champion of food sustainability and food justice. Making the Bronx in New York healthier has been Karen's passion for over 30 years. She fiercely fights what she calls food apartheid, a term she coined to look at the root causes of inequity in our food system, inequities based on race, class, and geography. Years ago, while working as a physical therapist at Montfleur Medical Center, she realized that many of her patients suffered from chronic illnesses, exasperated by a lack of healthy food options in local stores. So Karen went to work, helping to create community gardens, urban farms, farmers markets, food equity organizations, and the partnership with the New York Botanical Garden, an innovative program to help families and educators grow and prepare healthy food. Her partnership with the New York Botanical Garden continues to thrive. She's been an active and committed trustee since 2009, and her work with the garden's signature Brock's Green Up community gardening program has spurred a network of 200 gardens and urban farms across the borough. Karen is particularly concerned about the health of children. The Bronx has some of the highest rates of diabetes and childhood obesity in the nation. So she lent her expertise to help the Botanical Garden open the Edible Academy in 2018. This state-of-the-art facility offers classes and workshops to teach children, families, teachers, and the general public about growing and preparing nutritious food. Let's hear directly from this dynamo herself about her life and her work.
So I'm a project girl, proud of it. When I was 13 years of age, my family, we moved on up to Harlem and then got married and got 2 children, and then I moved to the Bronx in 1985, and I've been here ever since. Across the street was a vacant lot, and so when you live near a vacant lot, it becomes full with garbage. And when you live near garbage, people think you're garbage. And so by turning this empty lot into a community garden, I saw the transformation of how people's attitude changed. By doing that work, I started becoming an activist. There were so many health issues that were plaguing our neighborhood. But when you looked around, there were more fast food chains than hospitals, than medical centers, than health food stores. And so when we asked for a farmer's market to start in our neighborhood, we were given so much negative feedback that, you can't afford it, it's too dangerous to come to the Bronx. And so, since I'm a community garden and urban farmer, when we have a coalition, the La Familia Verde Community Garden Coalition, we decided to form our own farmers market. So with the Health of Just Food, Bronx Green Up, our community board, the health department, the parks department, and our councilman, we sat down, mapped it out, and then got 4 farmers who were willing to come to our neighborhood and got it started.
Karen is incredible, and her work is far from finished. Most recently, she's co-founded Rise and Root Farm, a 5-acre cooperative farm in Orange County, New York, dedicated to building a more equitable food system. Tonight, United Hospital Fund is proud to present Karen Washington, Urban Farmer Extraordinaire, with its 2021 Distinguished Community Service Award for her important work as a community organizer and activist, advancing food sustainability and justice, and creating a healthier, greener, more livable Bronx.
First, I would like to thank Ms. Duckett and the United Hospital Fund for this award. I also want to thank my former colleagues and hospital personnel who are doing heroic work at saving lives under tremendous circumstances. I see you. I feel you. I'm with you. So when Barclay first told me about this award, I was speechless. I was not thinking about myself, but more so my community as it continues to struggle to be healthy and to eat healthy. You see, my job as a physical therapist was to restore function and to improve the overall health of my patients. Now, as a farmer, my job is to grow food and to make sure that healthy food is accessible to all. Granted, I loved my job as a physical therapist, but there was a strong calling for me to grow food because I realized eating healthy meant being healthy and really living a healthy lifestyle. A lifestyle at times are cut short because in my community and communities like mine, we're surrounded by unhealthy food choices. So I go around the country stating that we live in the greatest country in the world where we grow enough food and we waste enough food, but that food is not getting down to the people that need it the most. And yet what is so sad is healthy food now has become elitist and expensive. Healthy food and clean water are both human rights. So I want to leave you with this. As an activist, I sow the seeds of justice. And when I see injustice, I call it out. So the next time you see injustice, what are you going to do? Again, thank you for this award and have a great evening.
Congratulations, Karen, and thank you, Barclay Collins, my predecessor as chair of UHF, for nominating Karen to be honored tonight. Our final award this evening is a special tribute to fashion designer Kenneth Cole for his role as founder and chairman of the Mental Health Coalition. The coalition is working to destigmatize mental health conditions and improve equitable access to resources and support. Throughout his career, Kenneth has used his considerable clout to raise awareness of social causes. More than 35 years ago, he zeroed in on HIV/AIDS. In 1985, Kenneth Cole Productions launched the first AIDS public service advertising campaign aimed at removing stigma surrounding that disease. He also took on several top leadership roles on HIV/AIDS, including serving as chairman of the American Foundation for AIDS Research. I had great pleasure of serving for more than 15 years on the AMFAR board with Kenneth and was witness to his creativity, commitment, and leadership firsthand. So it wasn't surprising when the National Alliance on Mental Illness, known as NAMI, approached him several years ago to sign on his firm as one of its first stigma-free companies. Those companies commit to promote a culture of acceptance about employees' overall health and well-being. Kenneth was moved by the enormity of the mental health crisis here in the U.S. and around the world. With clarity, Kenneth recognized the significance of this crisis years before it was understood. It's estimated that 1 in 4 people live with a mental health condition, but he would argue that it may be more like 4 in 4, given the impact on family and friends. Kenneth understood the strength of coalitions through his work on AIDS, and in 2019 created the Mental Health Coalition along with 8 nonprofit partners: the American Foundation for Suicide Prevention, Bring Change to Mind, Child Mind Institute, Crisis Text Line, JED Foundation, NAMI, and the Trevor Project. A brilliant strategist and convener, Kenneth is mounting innovative media and social media campaigns, all with the goal to fight the stigma that keeps too many people from talking openly and honestly about behavioral health challenges. He's tapped high-profile friends to help spread the message. In 2020, the 25-year-old model and reality TV star Kendall Jenner kicked off the coalition's first Instagram campaign talking about her struggles with anxiety and panic attacks. Oprah Winfrey, Michael Strahan, Katie Couric, and many other celebrities have joined forces and participated in the coalition's video one-to-one chats, speaking about the importance of mental health awareness.
Michael Strahan here. Yes. It's May, 31 days of May, and I am here. I am hosting the Mental Health Coalition for today, okay? Because every day in May, there are going to be live conversations around mental health, and I think there's important conversations for everyone to have. I think it's an important conversation for everyone to listen to.
I am here with the Mental Health Coalition handle. I'm kicking off a powerful new initiative because May is Mental Health Awareness Month. And I'm really excited because I think the story you're about to hear is not only going to be very moving, but maybe very instructive for people in all kinds of situations.
Kenneth's daughter, Katie Cole, created another initiative called How Are You Really? To encourage authentic dialogue about mental health. The organization's website is filled with mental health resources and offers specific support for Black and Indigenous people and people of color, LGBTQ communities, Asian American and Pacific Islanders, and friends and family. Kenneth, once again, you are using your intellect, your compassion, and the clarity of your voice to make a huge difference in the lives of so many people who are living with mental health conditions. United Hospital Fund is proud to present you with its 2021 special tribute for your exceptional work.
Thank you, John. Thank you for all that you do for the United Hospital Fund and for so many. In 2004, when I agreed to become chairman of AMFAR, it was partly conditional on John's agreeing to become my vice chairman. This is not just because of his thorough and thoughtful approach to everything he does, or because of his impressive attention to detail, but even more important, because of his passion for what matters. I'm honored to accept the 2021 special tribute from the United Hospital Fund on behalf of the Mental Health Coalition. This is a unique moment in time, as all of us are living through COVID, one of the worst public health crises of our time, where as 1 in 200 people globally are still living with HIV/AIDS, I committed to take this task on when I came to learn that 1 in 4 people are living with mental health conditions. That said, we at the Coalition believe that 4 out of 4 people are actually affected by it. If not by someone you love, then someone in the family, in the community, or in the workplace. We know that 2/3 of people with a known mental health condition never seek professional medical help. 1 person dies of suicide every 40 minutes. Every 52 minutes, someone dies as a direct result of an eating disorder. And overdoses are killing more of us than breast cancer, guns, and car accidents combined. The precipitous decline of our mental health was arguably the worst public health crisis before COVID, and the effects of this pandemic have compounded it exponentially. And while not all of us are living directly with a mental health condition, we all have mental health. And it is essential that we start talking about and caring for it. I don't know about you, but I have spent most of the last year and a half in a perpetual fog. At the Coalition, we believe that what makes this crisis so pervasive is the debilitating stigma associated with it. The Mental Health Coalition was founded to shift the narrative and people's perspectives, and I was proud to convene an impressive community of the most impactful mental health service providers in the country, leading academics, creative media, and business leaders with the common goal of changing the mental health narrative in a way that will empower rather than diminish those individuals living with mental health conditions. At the same time, we look to shine a light on some of the extraordinary work that is being done by some of our inspiring partners and organizations in the community. Many know that the more people talk about mental health and normalize the conversation, the greater the impact on the related stigma that today prevents so many from speaking out and or seeking the help they desperately need. This past May, also known as Mental Health Awareness Month, the Coalition hosted live one-to-one conversations on Instagram with well-known mental health advocates, and we've already had over 728 million impressions to date. We're encouraged by the qualitative and quantitative data that resulted when influential advocates such as Oprah Winfrey, Nicole Richie, Kevin Love, Michael Strahan, Deepak Chopra, and so many more had honest, unscripted conversations about their mental health. In addition, we leveraged our network to create useful stigma-reducing tools such as roadmaps to mental health, and are continuing to build out the largest and most comprehensive resource library with the ultimate goal of bringing as many people possible to care as needed. Congratulations to tonight's other recipients, the true heroes working tireless for equity in healthcare in New York. I thank United Hospital Fund for the honor. We share UHF's commitment to build an effective and equitable healthcare system for all. And we look forward to working with John, Tony, and the team on this meaningful and transformative work. Thank you.
Thank you, Kenneth. What wonderful honorees. We are both grateful and proud to have the opportunity to pay tribute to such exceptional individuals whose work reflects the core values of UHF and our mission to improve health and healthcare in New York. We are coming to the end of our evening and have one last special performer. Annalissa Vicencio, an arts and music therapist at the Children's Hospital at Montefiore and a doctoral student at NYU, will share her beautiful voice with us and close out our evening with a special song. But first, I thank you so much for joining us and for your support of UHF. Your generosity allows us to continue our work to break down barriers in health policy and healthcare delivery that prevent equitable opportunities for health. I wish you good night and introduce Annalissa Vicencio to sing Heal the World.
There's a place in your heart, and I know that it is love, and this place could be brighter than tomorrow. And if you really try, you'll find there's no need to cry. In this place, you'll feel there's no hurt or sorrow. There are ways to get there if you care enough for the living. Make a little space, make a better place. Heal the world, make it a better place for you and for me and the entire human race. There are people dying. If you care enough for the living, make a better place for you and for me. If you want to know why, there's a love that cannot die. Love is strong, it only cares for joyful giving. If we try, we shall see. In this place we cannot fear or dread. We stop existing and start living. Then it feels that always love's enough for us growing. Make a better world, make a better world. Heal the world. be.